Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Today in this video lecture we are going to see another topic that is related to diabetes, and it is about the oral glucose tolerance test. Okay, if you guys remember, we already talked about different diabetes tests, like we have talked about blood sugar test, in which we talked random blood sugar and fasting blood sugar, and after that we talked about HbA1c test, and then we talked about the glucose challenge test. Now this is our fourth video lecture that is related to the diabetes test, and it is about the oral glucose tolerance test. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. Dear friends, in this video lecture what we are going to explain, first of all we will see that what is oral glucose tolerance test. Then we are going to see that why this test is recommended and what this test is indicated and why this test is indicated. Then we are going to see the requirements, test procedure, and finally we will see the test result. First of all, let's explain the introduction. Dear viewers, this test, the short form of this test is OGTT, means oral glucose tolerance test, and it is actually the glucose test, or we can say the diabetes test, in which we will see the effect of the insulin level in the body. Okay, to just check the effect of the insulin level in the body and to see the breakdown of the glucose. Now what is the purpose or why this test is recommended? Dear viewers, this test is specially performed in those patients having FBS, means fasting blood sugar, is 110 to 125 milligram per deciliter. This test is also performed to diagnose the symptom of diabetes and pre-diabetes. This test is also performed to check or to rule out the benign renal glycosuria. What is this? It is actually the condition in which the kidney allow the sugar level to pass in the urine. Now why? Because in the body the pancreas didn't produce, or it cannot produce enough insulin to break down the glucose. So what will happen? On the other hand, the kidney will remove the glucose in the urine. Okay, this condition is called renal glycosuria, and it is actually also the mutation. Okay, and this is actually the mutation especially in the gene, like we have gene SLC5A2 genes. Then we have another point that says that this test is specially performed also in a pregnant woman as well, especially in those pregnant women who have big baby history, means they have after the delivery, so they have big baby, and also in those women that have miscarriage. Okay, so this is the main purpose and indication that why this test is indicated. Now let's see the test procedure. First of all, what will you do? You have to get the patient to stop the medicine that are using to control the glucose level. Okay, next you have to get the patient to stop eating food except water. If the patient drink water, no issue, but you have to get the patient do not eat, do not use glucose control medicine, okay, for at least 8 hours. So you have to make the patient at a fasting. So if let's suppose if the patient sleep at night, and after at morning time, you can perform this test very easily, and the result will be accurate, and it will give us accurate result. So this test should be performed in that situation or in that time. Next, once the patient have means let's suppose if the patient is on fasting, So then what will you do after 8 hour or after 12 hour? What will you do? You have to do a fasting blood sugar. Okay, and first you will do the fasting blood sugar, and you will measure the blood glucose, and you will check that how much the glucose level in the blood as well as in the urine as well. Okay, this is also important. Means you will take urine sample and the blood sample, and then you will perform the glucose test from the blood and from the urine as well, and you will check the result. Next, then what will you do after that? You will what will you do? So you have to give a glucose solution or glucose drink to the patient. Means the drink should contain 75 gram glucose in 30 means in 300 ml distilled water, in 300 ml tap water. So you have to mix 75 gram glucose, and then you give it to the patient. Okay, then what will you do? Dear viewers, we give this glucose drink to patient to just check that the effect of the insulin, or to just see that either the insulin is producing in the body, and either the body have the ability that secrete the insulin to break down the glucose. So that's why we provide the 75 gram glucose solution in 300 ml water. Okay, now once you give this solution, then after 1 hour, this is really important, remember, after 1 hour you have to take blood sample and then urine sample. And what will you do? You will perform RBS. Dear viewers, I already explained the glucose test. You can go back to my channel and watch the glucose test. Okay, so you have to watch the glucose test, then you will understand that what does mean RBS and FBS. RBS means glucose test on means after eating, and FBS means glucose test having means if you are on fasting. Okay, so then what will you do after the glucose drink? Then you have to take the blood sample and urine sample, and you will do the blood sugar test on the glucose, and you will also check the glucose and ketone bodies in the urine sample after 1 hour. And then after 2 hours, then you will again take the blood sample and to do glucose test, as well as to check the glucose in urine, glucose and ketone bodies in the urine. So this is the test procedure. Normally the test take 2 hours, okay, or 2 or 3 hours normally, but especially in the female, and especially in the pregnant female, means in the pregnant woman, the test will take 3 hours. Now here the question arises that why in the pregnant woman the test take 3 hours? Because in the pregnant woman normally the glucose level is high. Okay, that's why we provide 1 hour extra for the OGTT. Okay, another purpose is also that in the female, to just find the gestational diabetes, we perform the OGTT test for 3 hours, means it take 3 hours. Okay, that's the reason that why in the pregnant woman the glucose, the OGTT test will take 3 hours as compared to non-pregnant woman. Let's see the test result. Dear viewers, in the test result, the first means step means as we see that the glucose level of the FBS should be 70 to 110 mg per deciliter. If you see that the glucose range is between 70 to 110 mg per deciliter, then it is okay. Next, the glucose level should be also 80 to 150 mg per deciliter after 1 hour. Okay, and then after 2 hours the glucose level will be also the same as in the first hours. Okay, then if you see in the fasting, and if you see in the urine there is no ketone and no glucose detected, then it is okay. And after 1 hour and 2 hour in the urine sample, if you see there is also ketone and glucose is not detected, it means that the patient is non-diabetic. If you see the result like this, it means the patient is not a diabetic patient. If you see the changes in this video, it means that the patient is diabetic. Okay, this is really important. So dear friend, this is all about the oral glucose tolerance test. Thank you so much for watching. I hope you understand and I hope you like this video. If you like this video, make sure to hit the like button, share this video and subscribe the channel to get more interesting videos like that. Thank you so much for watching.